Executive Director of CFRI, the Cystic Fibrosis Research Institute, and I welcome you to what promises to be a very engaging discussion about the challenges of life with cystic fibrosis in Pakistan. We have a phenomenal panel with us today whose members will share their first-hand experiences. Before we get started, as always, please note that the information and insights shared in this recording should not be used for medical advice, diagnosis, or treatment, and please consult with your physician before making any changes to your health management plan. We thank our sponsors whose support through educational grants has made this webinar possible: Vertex Pharmaceuticals, Chiesi USA, Gilead Sciences, Genentech, and Viatris. We are so very fortunate to have with us today a panel to discuss the status of CF care in Pakistan and its impact upon the lives of those living with the disease. Our panelists currently hail from 3 continents and, of course, multiple time zones. Sajda Khalid hails from Pakistan but is currently living in New York. Dr. Ali Akbar is also originally from Pakistan but now lives in England, where he's a practicing, as we would say in the United States, pulmonologist, but in the UK, consultant respiratory pediatrician. Sumaya Shahid lives in Pakistan, where she has connected with the global CF community with her friend Rahima through social media sites. And in fact, that is how this panel came together, was through our connection through social media. So let's dive right in. Sajda, Rahima, and Sumaya, I'd love to hear about when and how you were diagnosed with CF and what were your family's reactions. And anybody can dive right in. Sajda, you wanna take the lead?
Okay. Yeah. Basically, in early days, I was in Bangladesh, where the temperature is not very severe. But then I moved to West Pakistan at that time. So the summers were very intense. That's the time I fell ill because of the heat. And after that, every summers I used to be hospitalized and the cough started, and nobody could figure out the problem. They, gave me all sorts of antibiotics. At the end of the day, it was eeny, meeny, miny, mo, let's try this antibiotic. But fortunately, my sister, and she was a medical student. So she and her friends, they used to ponder over me because they were the ones who used to rush me to hospital and take care of me. And so one of our colleagues, he suggested that I may have cystic fibrosis. Now, this was an outrageous suggestion. Other doctors did not agree. And since he was a student, nobody listened to him. But after many years, I kept taking antibiotics. Even when I took tuberculosis treatment, even though my Monto would be negative. And then in the very end, then a doctor suggested I should proceed to Brompton. Because he thought I may have cystic fibrosis. And at that time, there was no sweat test properly done. So I was made to sit in front of a furnace, where the things are sterilized. Then they collected the sweat from my forehead. Then they found, yes, the salt was abnormally high. At that point, I went to Brompton in England, London, and then it was properly diagnosed. And it was very shocking because initially somebody thought that if I surgically, maybe it can be handled, taking out those parts, but then it was not so. It was a lifelong thing. So I just started on the treatments then. And at that time, I used to take Ventolin tablet by mouth. It was only after a few years I got a nebulizer, because at that time nobody knew what a nebulizer was. And then there was nothing in Pakistan. So it was just my sister and her friends. And they are great doctors now. I feel it is because of them I was helped. And also my family support is the most important thing. My mother, she used to tap me for 2 hours at least, you know. She would be tired. Should I stop now? She used to ask me. I said, no, please go on. So yeah, that's how, you know, between infections and sleepless nights for my mother as well, it was hard work. And then later on, you know, when I got married, then I started traveling abroad. I once came to Georgetown University in a hospital here in US. I met Dr. Kulchuski, who was a pediatrician. He gave me a bronchial lavage. It felt really good. You know, it felt like I have a new lungs again. But then I went back to my country. I kept going to England, Australia. My sister had shifted there. So every summer I used to get myself checked and get the recommendations by the doctors. And my sister, she used to send me hypertonic saline from there, because over here they used to give me saline in a big 1 liter bottle. You know, so I didn't use that because, you know, it could get contaminated. So I used to get my hypertonic saline from Australia. And then now I got married, I had 2 children, they came to US, you know, so I came after them. Now and I have Trikafta, and it has changed my life, because earlier I was dragging myself. I mean, everything was difficult. So it was a big struggle at that point. But now since I have Trikafta, I am a lot better.
That is wonderful to hear, and you are very fortunate that you were able to access that. And I imagine, Sumaya, you have a bit of a different story. Would you share with us how you were diagnosed and what your family's response was and what kind of support you have?
Yeah, sure. As I told before, I was diagnosed in UAE since I was born there. So first, I was having the digestive issue which are related to CF. I started my career on treatment right there, but then after like at the age of 2.5, I shifted to moved to Pakistan back. Then I was like a healthy child, so my family didn't more focused on the stuff that's CF. There was no awareness of CF in Pakistan. Nobody knew that it can be a drastic disease that can change and affect life so much later on. So there was no such treatments in here in Pakistan. But right at the age of 8, I was re-diagnosed with CF due to the same digestive and GERD issues, which was like severe one. So I was re-diagnosed CF with the sweat chloride test, which was only available in Pakistan. So at that time, I started my like lungs treatments as well, the nebulization, and like the proper every treatment that the CF child must take. So like it was like 2 times diagnosed in my life CF, and currently it's like so it's at the progressive stage. There are no such treatments available, and right now also I'm dealing with the CF critical situations. So that's the story. And still, like in the early age when I was re-diagnosed with CF, there were some like shocking, and the condition, according to the condition, the family was already tensed. Also, it's like a disease in my family. My cousin sister had like one of the cousins, and we lost her at the age of 14. My elder sisters, like I had twin sisters before me, which were expired, like they got expired at the age of 3 because of the same situations like pneumonia again and again, pseudo and lung infection. Like they had like severe ones, but their cystic fibrosis was not diagnosed as there was no knowledge of it at that time. So that's how I was suggested to, like when in Pakistan we came back and I was having the worst conditions. According to the doctors, they know the family history, and they suggested me to go for cystic fibrosis test again. That's how I was re-diagnosed with CF.
I am so sorry to hear about your siblings, and
Yeah.
were your parents told, any indication what would have caused the deaths of your siblings? Was it that a diagnosis of TB, or was there any diagnosis?
No, it was like pneumonia. Only the people, what people said, like what people said at that time, it was like pneumonia and the infections, the lung infections. No TB was diagnosed or no CF was suggested at that time.
Dr. Akbar, I'm very curious to know how you became interested in cystic fibrosis as an area of care.
Good evening and good morning, as we are from different part of the world. I was born in Pakistan, and that's where my roots and links are. And I migrated to UK after my elementary education, basically, and still had a couple of years to go to school in the UK. And then I sort of did the rest of my education in the UK, qualified as a doctor back in 1985, which is a long time ago now. And I was working and training as a pediatrician, and through that process, I opted to go for respiratory medicine, pediatric respiratory medicine. And as part of that, we have a regional center in Birmingham in the UK, where we had nearly 350 CF patients from our, what we call the West Midlands area. And obviously, as part of the respiratory training, I was coming along and seeing lots of those patients. And I met quite a few of our Asian patients coming there at that time. And I said, oh, if there is Asian population here who have CF, there must be patients back in our own countries, in the Indian subcontinent, India, Pakistan, and the rest of the world. And they must be having it. So I started Googling a little bit, and I did see a few publications, even from Pakistan, about cystic fibrosis. But that was just a couple of publications. And so I thought, yes, some doctors are possibly aware of it. So perhaps we need to do a little bit more on raising the awareness of the condition in Pakistan. And I was fortunate enough to be invited to the Pakistan Pediatric Association's biannual international conferences. And I took that opportunity when I went to Pakistan to talk about not only other respiratory conditions, but also cystic fibrosis, that people just sort of labeled me as, oh, he's going to talk about cystic fibrosis again. And it was nice that I did do that, because there's lots of people from all over the country who would come to those conferences, and they took back my blue slide message about cystic fibrosis. And that's how it started getting involved in people and families with cystic fibrosis, to the extent that I took my CF team with the physiotherapist and dietitian, and myself, another consultant pulmonologist, as you may call him, to Lahore Children's Hospital back in 2015 to have a symposium on cystic fibrosis, which was one of the first ever 2-day symposium on this condition, which nobody had heard about in Pakistan. And it was quite good attendance, and we had a few patients coming to that as well, because I had started CF WhatsApp group for Pakistani families. And so some of those families traveled, and it was very educational sort of program in that. And we did some clinical sessions there as well for those patients who had traveled for about 700-800 miles, for example, from part of the country, just to come and listen and see us. And I've still got linked with that. I still run that group. So that is how I basically got very much involved in that group. And nowadays, whenever there is a CF diagnosis somewhere, somebody somewhere does know that we have a patient group who can support them, and they are added to the group. And we carry on talking to those people, providing the facilities as much as possible with diagnosis, guiding them to the right place. To the extent that we are now able to dig into some of the resources where we can do genetic testing. It's not readily available, but it is still available in some part, and they may have to travel a long distance to come and have that. And I'm quite pleased that some of the families have taken up the prenatal diagnosis after their genetic testing as well, and managed to go through their pregnancy to either terminate or decide to live with or have healthy children. So at least the facility has now become available. And I think through that raised awareness, etc., we are now in a better position that more people are aware of it, and people do have access to some of the facilities now, but we may come and talk about what we lack in Pakistan and discuss it further. But certainly the awareness is now there, and every time I visit, I do make a point of holding some clinics, bespoke clinics in different parts of the country wherever is possible, to see some of the families who are in my WhatsApp group, and it's a pleasure to see them face to face as well, and have that sort of good link with them as well. So that is where my link with the CF and CF in Pakistan came about, and is thriving pretty well. And I'm hoping that it will carry on to develop services within Pakistan, so the local pediatricians or local respiratory consultants or pulmonologists may take on this task and deliver the services locally rather than somebody sitting in the UK telling them what to do.
And have you heard any stories? I imagine for some physicians, hearing you discuss cystic fibrosis, it might have given them that aha moment, like about patients who had symptoms that they were not clear about. Did you help people identify cases that they previously had not known among their patients?
So I think the issue was about awareness, not only within the ordinary population, but all the medical profession. And what I have been able to do so far is actually raise the awareness within the medical profession, because that is where my contact is at the conferences that I actually attend in Pakistan. And then through my patient WhatsApp group, and now we have a YouTube where we actually uploaded lots of videos, informative educational videos about cystic fibrosis for anybody to go and visit and see. And I think that is where I come, that, you know, it is the awareness of those conditions come in. And when I do talk to some of the people there, they say, yes, we do see patients, but the situation that we have in the UK or United States with multidisciplinary teams, with physiotherapists, dietitians, psychologists, social services, people involved in all that sport, that is lacking in Pakistan. And to the extent, you know, somebody did remark, one of the medical colleagues did remark that he said, for a few patients, I am not able to set up that service because the health system there is not geared towards it. It's mostly private service. And therefore, CF, as you know, is a time consuming. You have to give the patients the time, you have to give the families the time, you have to listen to them. It's not just a 5-minute job. And that is something that they find it difficult, and quite rightly, because, you know, time is crucial for them as well. And they have long waiting time. The clinics are overbooked. And, you know, sometimes I go and see, you know, there's 2 or 3 patients being dealt with at the same time simultaneously. So I think we will get there. But in the first instance, raising that awareness is being successful. The parents and families now are spreading that word to their families, because 6 years ago, when I was talking to the CF families in my group, their own immediate family members didn't know what their children got. They were hiding that. They thought it wasn't something that could actually declare openly because of the cultural things within Pakistan, that the children will grow up, they may marry within the family to cousins, etc. And they didn't want to declare that because their children may not be able to marry the other cousins, etc. within the family. So they were keeping it a secret, but not now. I think they are very open about it. And they say, look, we got some of the conditions and we want to tell people what we got so that we can do something about it. And with the prenatal testing, etc., and all that, which is becoming now available because of the genetic testing that some people are having, that made it life easy. And I'm able to convey that message to them. Like thalassemia in Pakistan is quite common, and government recommends that before marriages, people actually have thalassemia screening done. So if they are both carriers, then they decide for themselves whether they should go ahead and have that marriage or not. So that option is becoming available to them. And therefore, I think people are more open about the condition, which I'm glad that we're getting somewhere.
And I'm thinking of you, Sajda, sitting in front of a hot furnace to do a sweat chloride test. Dr. Akbar addressing the shortage of resources in Pakistan. So I would love to hear from Sajda and Sumaya your experiences, and in particular, I'll start with you, Sajda, about your experience of what your life was like with CF in Pakistan as opposed to once you moved to the US.
Yeah. So over here, it was just that, I mean, I was doing my physiotherapies twice or thrice a day. And whenever I got the infection, I was given antibiotics by my pulmonologist. So over there, when I go to my doctor in US, I mean, it's a proper clinic. It's one doctor after the other that checks you. If somebody comes in for a physiotherapy and social worker is there, it's a proper team over there. But over here, we have to go and look for the doctor ourselves by the reputations or who is checking us better. And I used to go to my pulmonologist. He prescribed the medicines, mostly IV antibiotics. Then I was afraid to go into the hospitals over here because of the infection. I mean, people I felt were not very careful. So I used to take antibiotics, IVs at home. My sister's friends, they would, they were proper, I mean, they are doctors. So they would come and help me with it. They kept an eye on me, used to visit me at home. And a nurse would come and do the IVs on me. And then my family, they used to take turns doing my physiotherapy. So in fact, especially my friends, they loved doing the therapy on me because they were tapping away. So, so it was a joke for them. Okay, come on, let's beat her up. So it was fine. I mean, I got beaten up and got my sputum out, and they had their fun. So yeah.
And with
But
I'm sorry, with the IV,
yeah.
and are you able to have, in Pakistan, cultures in which, the specific pathogens are identified? Is there that level of testing?
Yeah. And when you have infection, then Pseudomonas and Staph, they were the most two common ones I used to get. And then the whichever broad spectrum antibiotic was there, especially like lately, I remember taking tobramycin, meropenem, these medicines I used to take. But that's about it. There was no Pulmozyme. And now I take Pulmozyme. At that point, I didn't take Creon, but just before coming from US a week and a half ago, I was diagnosed that I am also pancreatic insufficient, and I was diagnosed. Doctor told me to take Creon. But over here in Pakistan, Creon is, I mean, it's in a very limited supply. I dare not go and ask somebody, please, I need Creon. It's just when I go back, I'll get the supply from there.
Wow, that is hard because enzymes are so critical for so many reasons, and the connection to nutrition and lung health. Sumaya, do you want to share your experiences? Do you have enzymes, nebulizer, anything for respiratory therapy?
I would like to add one thing to the culture thing. Like right now, when recently I had my culture done, and have IVs resistant. Most of them are resistant, so there are no, like, they do the test for the medicines that are available in Pakistan, of course. So there are no other such things, like they don't go for alternative to search for something else that can work, because obviously that's not available in Pakistan, so it's gonna take a longer time period and all. So that's a lag, I guess. I think so, and I'm like, I can say I'm going through it right now. So that's something else. And the other thing that she told about the pancreatic exam, yes, we lack in them. There, as Dr. Ali mentioned about the group, WhatsApp group, there we have people who can arrange the Kineon supply for us, and we can ask for them from them to, like, we need them 1 bottle, 2 bottle, and then they'll give us with the amount paid. So that's how, like, most of them, if I say, the group helps us to arrange the medicines, mostly the carrion enzymes, because like there are two types of carrions. One is from the Istanbul and the other ones are from Germany. So like yeah, sorry for this, but right now I'm so like disturbed from psychologically, so that's the only confusion here. So like I was saying that the crayons that are available in Pakistan are from the Istanbul one, and to me that didn't suit well, because from the start I've been taking the crayons that are from UAE, which are from Germany. So that's also the issue I'm facing right now.
Just so difficult to access. And Dr.
Yeah.
Akbar, how, what would you most wish for your fellow medical colleagues? You know, what you wish they had access to as they practice in Pakistan?
I think, as you heard, a couple of people having issues getting to the right medical help is one of the important things as well, that they have access to the proper health service, the one who knows what to do. Because very frequently what I see being, sort of leading the WhatsApp group is that they may go to a pediatrician or so, and even a 3-week-old baby may start on lots of nebulizers, lots of medication, some unnecessary without the actual individualized approach. So I think somebody needs to be properly trained in the future for CF things, which is what something's lacking on the medical side of things, that we need properly qualified, trained medical personnel who know what to do rather than do the Google treatment. And other thing is, like Sumaya mentioned, cultures is a big issue. We have different techniques to take samples from babies, etc., which are not available in Pakistan. And when people are taking sputum cultures in Pakistan, they only think about TB. And they, to the extent I've heard, a good sputum sample taken at lunchtime or 2 o'clock in the afternoon, lab will reject because it wasn't the early morning fasting sputum sample, which really doesn't make any difference once you got sputum sample. But they work on other things, or sputum. So what TB, for example, we say just get the early morning sputum or early morning gastric washings, for example, or gastric aspirates. And I think that's what they used to. So they're not used to the CF cultures. And similarly, the antibiotic sensitivities they set up, they may not be appropriate for the CF population. They may be for the ordinary public, but not necessarily for the CF patients. And also it may be that they are driven by the pharmaceutical agencies who are selling the antibiotics to say, these are the antibiotic discs that you can use for sensitivities, and therefore it only shows certain antibiotics and not necessarily the whole spectrum of antibiotics that may be useful. And also, there's a huge widespread prevalence, or I call it abuse, of antibiotics in Pakistan, because they are so easily accessible, prescribable for many qualified or unqualified doctors sometimes, which the government is getting hard at it at the present time. But because of that, there's a huge resistance. So I've seen even 3-week babies diagnosed cystic fibrosis, pseudomonas, multi-resistant. And it is not there. I think they acquired that from the hospital setting. That's what Sajida was trying to point to, that she didn't trust the hospital environment and the hygiene or cleanliness, because there are infections there. And I seen 2 or 3 babies in the same cot, for example, looked after, because of the lack of resources, lack of beds. And therefore, and I think that's where the infection control measures don't actually work in Pakistan, and therefore use of antibiotics, high potency and very broad spectrum antibiotics, and development of resistance is there. And once you got multi-resistant things, like Sumaya is saying, then we got no other options, no other antibiotics to be able to recommend. And that is one of my big headaches on the WhatsApp group, for example, when they send me a report and it's all resistant to everything. And I say, I'm sorry, there isn't anything else I can suggest. And because I'm not physically there looking after them, monitoring them, I'm hesitant to recommend this in a higher dose and this, that, and monitor, because I don't want them to suffer as a consequences of the side effects of those things as well. So I think it is a big problem with antibiotics cultures. With regard to the Creon, as Samir mentioned, within the group, we've identified a couple of people who may be able to access from basically Turkey, Istanbul, and sometimes from other places as well, and then provide them to the group members, which has helped quite a lot of people, because majority of the people, as you know, with cystic fibrosis do have pancreatic insufficiency. And Sajida may have been one of those who wasn't, and then developed insufficiency, which some children do, or some patients with cystic fibrosis do. They usually are pancreatic insufficient at the beginning, and then over the time scale, they may become insufficient. And that's, I think, what's happened to Sajida as well. So Creons are now available, but sometimes we do run into problems. There are legal issues with that as well, because the government doesn't want to import certain things, especially medicine from abroad. Sometimes people talk about Creon derivative from pancreas of the pig, and therefore religiously people may object to it, although health, really religion actually says if it's there for you to save your life, you're okay with it. But some people may still take that and say, oh, I wish we had alternatives. Pulmozyme the same, when we had it at the beginning, and we don't have that available. We don't have tobramycin, we don't have colomycin available nebulized wise. So it's sometimes IV preparations, people then resort to gentamicin, which is cheaper, more economical to use. Amikacin, which is readily available because of the TB that's used in TB, so people use that as well. So I think it's less favorable medication that they may, or it's compromises that people are making there, and obviously that compromise then does affect their longevity, their prognosis and outcome, as compared to what we have in the West, where we could optimize things. And things we're talking about, the Trikafta and Kaftrio, as we call it in the UK. That treatment is not available in Pakistan, not affordable in Pakistan. So those are the difficulties, definite difficulties. The hypertonic saline pharmacies are preparing themselves, and we don't know how sterile, how good they are. And the ones you import or you get, there are difficulties. I think I took once for one of the families, and I got stopped by immigration because when they're scanned, they look like bullets. They wanted me to open up that to see, I wasn't carrying any guns and bullets, for example. So I think sending across or taking across, there are restrictions, legal restrictions on those as well, which makes it difficult. But I hope with the raised awareness, with local teams taking the awareness responsibility for those patients, and then they can ask the government and the authorities to see if for certain people or certain group of people, they can make these available. And if they started making available or even manufacturing locally, like it happens in our neighboring country in India, then the price will come down as well, rather than having to import from other places.
So difficult, isn't it, when it affects a small number of people, and so you don't see the profit margin in terms of a company to develop for a small group within the country, but it ends up, really it seems, a group of the disparities within the CF community in Pakistan, who has access to relatives who might be able to bring medications, and those who have no access. I am curious, for people with advanced lung disease, in the United States, the UK, transplant becomes the option for people who have very advanced lung disease. In Pakistan, are transplants ever done for people with CF?
So to my awareness, transplants are done. I know one of my colleagues here in Birmingham, he's a liver transplant surgeon, and he'll go and do liver transplants there, for example. He'll fly for a weekend, do the transplant and come back. But we do not have that for pediatrics at the moment. Pediatric liver transplant is not an option at the moment, although I hear that they may be starting or thinking about starting that. Adults, they may be doing it. They are very good. There are good surgeons at resecting out the lungs, but not necessarily putting them back in again. And for various reasons, I think. And I think CF, for example, one of the things is that we get Pseudomonas grown. Sometimes it may not be Pseudomonas. It may be Bacteria species or other species of it, which are multi-resistant, but because they're not doing those tests and microbiological testing, we don't know. And some of those used to be contraindication to transplant or something like that. But I think it's a lot of work to be done. Currently, there is no pediatric lung transplant service in Pakistan. We had a one CF family who actually moved to the UK for that service, and she got lung transplant done there as well. And we have another of Pakistani origin living in Canada who had lung transplant, but they were living in Canada. So we have a couple of patients within our group who have had lung transplant, but obviously abroad rather than within Pakistan.
So CF is quite often referred to as an isolating disease, obviously because of cross-infection risks, also the smaller numbers. So Samaya, I'd love to hear from you how you have connected with the CF community within Pakistan, but also globally through social media.
I did connected with CF community in Pakistan first through the group that Dr. Lee's already mentioned. So like the girls were there. So like first CF sisters connected. So I came to know them, and then how their condition is. So at first it was kind of hope that there are others like me too, because before that I haven't seen any CF sisters or brothers anywhere around me other than my family members, the cousin I told about. So it was like kind of hope that there are other people like me, and it was motivating to fight with them. Like I'm not the only one fighting with CF. And when I came to the social media platform like Instagram, I came to know about Rahima. Before that, Rahima wasn't in touch with me. So like I came to know about Rahima and then the CF from abroad. Like seeing their life was like totally different from us, and it was motivating me to like bring the awareness towards the people of Pakistan that there are also people living with CF and how they are spending their life fighting for the basic treatments that are like basic needs for them, which can be really available to the which are available to the people living abroad. And then I came to know about the advanced treatments and all, like how the people manage CF abroad, and like and also the studies that are going on about the CF organization and CFRI, other group of CF related foundations and non-funded organizations. It was kind of hopeful seeing people taking the medicines to spend their life, and it was kind of like a company or group of people like you, and also motivating like commenting on the people with CF, sharing their stories which you can totally relate with them. So it's like only they can understand how you are suffering with CF.
Sasha, do you want to add in, or did you connect with your fellow cystic fibrosis community?
Yeah. Over here in Pakistan, I was pretty lonely. There was just one girl who had CF, and she passed away during her school years. And after that, I had a bit of a setback. I had to go see a psychologist for some time. So the psychologist, she, in a very straightforward manner, she said, look, don't worry about death, because anybody can die even crossing a road. I mean, this was such a simple and cruel sentence to me, but somehow it set me right. After that, I was fine. Fine in the sense, yeah, I stopped thinking about the morbidity of it. And I was never on social media. And so I was very lonely. And whenever, there were people, there was some gathering or anything, I had to opt out of it. I was not well. So gradually, I got isolated also. People would stop inviting me to the parties and all, and then I was never able to move about too much, get out of the house for fear of infection sometimes. And sometimes I would be coughing so much that it got embarrassing as well. In my school days, especially, I remember whenever my teacher used to ask me a question, as soon as I opened my mouth, I used to cough. So they thought I was just, faking it. I didn't want to answer them. And so I would just, start coughing. So, yeah, so that was during my school days. But, when I moved to US, I joined Beam Feel Good, the exercise group. That's the time, I met people. Because earlier, whenever I used to go to other clinics while staying in Pakistan, I never got to see any CF patient, nor I was connected to anybody. But after I joined this group, especially during COVID times, I mean, it was such a big support for me. I was so grateful for that group. They gave me company. I mean, we had the same stories. It was amazing because over here, people simply did not understand my problem. They used to say, "Oh, you look fine. You're just faking it." I mean, this was always being told you're faking it was little. It was it just gets to you sometimes. But now, and also because of this group, I started going on Instagram. And Sumaya and Rahima, they were the first two people I saw, and I was surprised. Oh God, there is cystic people in Pakistan. I didn't know. And then, they introduced me to Dr. Ali as well. Then I joined their group as well. So now I'm connected to Pakistani CFers and in America, other places as well.
I would like to add here, I got to meet Sajda from Instagram. I forgot to mention that before.
And do you have thoughts about what can be done to better integrate or connect the global CF community? This is a question for all three of you.
Shall I be the first one to answer that then? I think medical profession itself, we need to be talking to everybody around the globe. Share our experiences, share our difficulties, share any advancements and improvements in the treatment and medication. So as medical people, I think we do that through, for example, international conferences, etc., and share the ideas with each other. And therefore, that does convey some of the message to the other members living in different parts of the world, what is available around there. Just like social media and these CF patients from Pakistan and families from Pakistan learned what is available. Social media has played a great part in it to know what is, and that's what I was talking about, the Google treatment type. People are aware of it. Whether they use it appropriately or not, that then we need the properly qualified people to guide them through that as well. But I think people are becoming more aware of it. And like I mentioned earlier on, people were afraid of mentioning that their child's got problem within the family. Similarly, those infection control measures, etc. We have a lot of family who live in extended family format, etc. And people just like Sajda mentioned, they say you're faking, your child looks fine. Why do you have to do the physio twice a day? Why do you have to give nebulizers or keep giving nebulizers? They look okay. They don't buy the concept of preventative medicine, for example, to stop these things happening in the future. They just think they have to be treated only when they're sick rather than prevent them becoming sick. So I think those sort of things globally, we do need to link in with people. We do need to know what is available in the rest of the world. We do need to have access to those and facilitate access to those so far as possible through whatever means for the sake of these patients who don't otherwise have a chance. And I think it's just like many other things, the rich and the poor gap and the availability of resources from the developed countries, underdeveloped countries, that is present. And I think from the medical point of view, from the patient's point of view, I want that gap to be less and less as we move forward.
Thank you. Sajda, do you want to jump in?
Yeah, I feel it's just that need to raise awareness among patients as well, so that, the medical community wakes up to it, that yes, there are people who are asking for help. And also, like, I feel like, I mean, experts from the other places, they should be training people here, maybe on Zoom, or like physiotherapists talking to people over here if they have time. I mean, some volunteers to, guide or something like that, maybe guide the patients. Especially, I feel more about the physiotherapy. And obviously, medicines, as these things are not available either, which is a big thing. But yeah, from physical therapy point of view, need better physiotherapists as well.
Thank you. And Smaya, you want to give your thoughts on how to raise awareness and also make sure people know how to find you on Instagram?
I would second Sajda and Dr. Ali that we need to raise awareness among the people, and somewhat we need to motivate them to go for it, because that's the main thing. Awareness can be done so much, but unless they don't want to go for it, they won't. That's what I am seeing right now. And Dr. Ali must agree to this because he had been working since years for creating the CEF clinics in Pakistan. And that's where we lack. And the thing about finding me on Instagram, right now I've deactivated my account because of some few issues. So hopefully I will be reactivating it again, maybe sometime.
And we look forward to that. And we will help spread the word once that happens. And I really do feel this is the first of future podcasts to come, excuse me, to raise awareness. We have come to the end of our time. Very sadly, this time just flew by for me. But I thank you for this incredibly enlightening and inspiring conversation. I thank you, Dr. Ali Akbar, to Sajda, to Samaya, for speaking so eloquently and so personally about your experiences. So I thank you so much for sharing your time and your insights. And as I say, I think this is the first of more to come. So thank you all.
May I thank you as well, Siri, and also Stacy and the CF Research Institute for taking your time out to listen to us, to listen to the CF families from Pakistan and helping us to raise the awareness of the problems and issues that we have in Pakistan, with the hope that we can overcome these difficulties for the future and make the lives of the CF families much better in the future. So thank you very much indeed.
Yes, thank you very much. We're grateful for you to reaching out to us. I
Thank you so much for taking
you
the
guys
first
are
step
doing a great
towards.
job.
Thank you so much for taking the first step towards the change. Hopefully, we are looking forward to it.
And thank you for saying first steps. There are more to follow. So thank you all.